Sports medicine, not just for athletes. We all have to move, so we need to make sure our bodies are able to carry, support, and keep up with what we want to do.
Yeah, University of Michigan Health West has more than 2 decades of experience with physicians, therapists, trainers who can all be part of your care team. Dr. Edwin Cornolia joins us this morning. He's going to explain how they can help get you moving. Good morning, doctor.
Good morning.
Pain-free, I should add that part.
Pain-free.
Moving pain-free, because that's really the important part. Sports medicine, we were just discussing off air, is medicine for all. Can you explain how the similarities go from what you deal with an athlete versus just everyday people?
Absolutely. You just hit the nail on the head. All of the activities we do, we treat our athletes for sprained ankles, well, we can do in our daily lives as well. So you might sprain your ankle playing football, or you might sprain your ankle walking down the street, but you need care. And a sports medicine physician can take care of both of those people, get both back to the game and back to life, because being active is helpful both mentally and physically. And so we want everybody to be active, not just the people playing in sporting events, but also the rest of us as well.
Right. And so tell us how this team effort works and how, you have this whole slew of specialists who can help a patient get better, but then also be proactive in the future.
Absolutely. We've for years have worked with the Griffins, we worked with the Gold, we worked with the Grand Valley, we worked with high school teams all over the place, recreational runners, recreational athletes. And so what we've had to do to make that happen is make sure we have all the people around us to get people better as soon as possible, because the pro athletes want to get back out there ASAP, so do the middle school athletes. Everybody wants to get back out there ASAP. So our program, our system is designed to get people in, get them evaluated, get an x-ray, perhaps get an MRI. If something more serious has happened, we get them over to a surgeon ASAP, or get them directly to rehab, because again, life is a contact sport, sports are a contact sport. We want to get everybody back doing what they want to do as quickly as possible. And you're important if you're on a team, and you're important if you're not on a team.
Yeah, whether you're going back to the soccer field or back to the garden.
Absolutely.
I mean, you want to be able to move pain-free. A lot of people equate sports medicine with physical therapy.
Correct.
These are not the same things.
Correct. So there are physical therapists who do sports medicine, but we are primary care sports medicine physicians, so we're uniquely qualified. We don't do surgery, but we do everything short of surgery, and most of the things that happen to us aren't surgical. They just need someone who understands how the body moves. And so we're physicians who take care of concussions, we take care of injuries, we take care of heart problems, we take care of all those types of things. And because we're primary care physicians, we know how to plug into the specialists who are needed to get you back as well. So we kind of take the primary care model, but we apply it to sports medicine. And so we're primary care sports medicine physicians taking care of the whole body.
Wow. And so I know this varies patient to patient, but when someone comes to you with an injury, how long are they typically working with you?
Right, exactly. It can be short or long depending on what it is. Like I saw sprained ankles this week. We're talking a lot of high school sports. People are getting injured right now. Football playoffs are starting. Cross country is getting towards the end of the season. And so sometimes it's a few weeks to get through the end of the season, and sometimes it's longer. Sometimes I'll see someone, they're training for a marathon, and that might be a 12 or 16 or 20-week program. And so I'll see them towards the beginning. We might do some lab work to make sure that their iron levels are good, and then we'll help them through any sprains and strains and get them to PT if needed, and get them through their marathon. So it can be weeks to months depending on what the problem is.
And when it comes to seeing a sports medicine, a specialist, in that field, do I need a referral? Do I talk to my primary care physician? Do I have to have one of those?
You can get a referral from your primary care physician, but we can also see them directly as well, because we are primary care physicians. And we always try to say we can take care of those primary care needs, but we also can work right alongside your primary care doctor as well, and not take over and just do the sports medicine piece. So we're actually kind of a little bit in both worlds, in the primary care world and in the specialty world.
Okay, so what indications would someone have to be like, hey, I need to give you guys a call today?
Yeah. If you can't do what you like to do for more than 5 to 7 days, come and see us. So if it's walking, if it's running, if it's working in the garden, we know, again, if we move, we are mentally and physically healthier. And so if there's something that's keeping you from doing what you like to do for more than half a week to a week, get in to see somebody who can help you get back moving again.
Perfect. Great information. Thank you so much, Doctor.
Absolutely.
Absolutely perfect. You want to learn more about this? You can visit uofmhealthwest.org. There's a bunch of slashes there.
Yeah.
Don't worry. We'll have the link for you at fox17morningmix.com as well. We'll be right back.